All right, good morning, everyone. It's 10:02 a.m. So I just want to welcome everybody to the March webinar. This month's topic is going to be on behavioral health plans 274 data submission. Today's date is March 26, 2025. To introduce myself, I'm Alvin Batista. I am a RDS2 specialist and your month's webinar moderator for the Managed Care Data Support section. Today's agenda will be covering two topics. First topic will be 274 Behavioral Health Companion Guide, which will be effective May 1st of 2025, and the changes to the 274 Behavioral Health Validation Response File. DHCS staff, we will be having two speakers today. The first one will be Sarah Rivera, and the next one will be Christine Fessler. And you have your support staff on the right, which includes myself, Abby, May, Xiaoyan, and Felicia. For questions and answers, so for general questions, please submit your question to the WebEx chat, and please ensure that your questions are visible to all participants because I am not monitoring the private chat. In addition, for specific questions, please reach out to the appropriate data mailbox as will be instructed closer at the end of the presentation. Before we move on, today's webinar is being recorded for documentation purposes. The recorded video, script, and presentation materials will be uploaded to the data reporting and monitoring webinar series in that link that's there in that slide. And also to the glossary and FAQs are also updated regularly every month. And before I move on, I would just give a notification, just a quick notification. Starting in May of 2025, we will be changing to a new meeting platform. So instead of WebEx, we will be switching to Microsoft Teams because our webinar is getting bigger and you guys love us that much. So I just want to make sure you guys are aware. And also just a reminder, please make sure that you turn your microphone off if you are not presenting right now. So thank you guys. So I'd like to hand it off for our first presenter for our first topic, 274 Behavioral Health Companion Guide, version 3.01. And I'd like to introduce Sarah Rivera, 274 Behavioral Health Project Manager.
Hey, Alvin, can you hear me?
Hey, Alvin. I think Sarah's having some audio difficulties. Sarah, can you hear me? You need to unmute. You're on mute. Can you unmute? Let's unmute Sarah.
Let's try to unmute Sarah.
Yeah, she's having some audio issues here.
Can
we
you
can hear you, Sarah.
Yes.
Okay.
Yes.
I
Cool.
had to call in through my phone because there's something wrong with the computer. So,
Okay.
all right.
Well, hopefully moving
Cool.
to Teams will make this a little more stable. So
yeah.
Yes.
Thank
So
you
before
so
we
much.
start, Sarah, I just want to formally introduce you again. So this is going to be the 274 Behavioral Health Companion Guide version 3.1. So I hand it off to Sarah Rivera.
Thank you, Alvin. You can go ahead and go to the next slide. So back in January, on January 27th, we started this communication, fairly early in January, but we had announced that DHCS would be making changes to the 274 companion guide, which would become effective on May. And these changes would impact the MHPs, the mental health plans, the DNC ODS plans, and the new integrated behavioral health plans. But after looking at the timelines, DHC and county readiness, DHCS is pushing out the effective date by 1 month. And we did announce this in Monday's work group with the plans. So no new information here. This is just to make sure we have multiple channels to announce this information. But the changes in this companion guide will now become effective on June 1st. And it's also impacts the testing environment, which will become available on May 1st. We did release a new version of the companion guide. It's now called version 3.01, and we'll talk more about those updates. But with that update, it has the new effective date and then just some minor corrections that we found in the previous version. So just as a reminder for all that are in this meeting, this companion guide does update impact the MHPs, the DMC ODS, and the IBHP. Next slide. So the companion guide that we released on Monday to the plan, you'll see at the very bottom, it says companion guide version 3.01, effective June 21st. It includes some minor corrections. We had placed the IBHP, which stands for the Integrated Behavioral Health Plan Provider Indicator, in the wrong place in the guide. It was in the correct location in the detail appendix, but we did have to move that. And we also clarified some warning messages that are in the companion guide. Next slide. So for the IBHP provider indicator, in the version 3.01, we had identified, and this is off to the left, we had identified the IBHP indicator in loop 2100 EA N201. And so that actually should have been in, and we updated 3.01, that indicator should have been in loop 2100 EA N202. So the updated companion guide now has this indicator in the correct location. This change does not impact where that indicator is located in the provider detail, Appendix A.2, which includes all the business rules associated with that indicator. It was in the correct place in Appendix A2, provider detail. It was just in the wrong place here. Next slide. For the all the data elements associated with the contract effective date at the group level, the site level, and the provider detail, we wanted to clarify a distinction between when a fatal error would be set versus a warning message. So if the contract effective date is equal to or less than the last day of the reporting month. If it's not equal to or less than the last day of the reporting month, a fatal error would be set, because this means that the contract effective dates are in the future. So as long as the effective date is sometime within that reporting period or prior, then it'll pass that edit. The contract expiration date must be, oops, can you go back, Alvin? Yes. The contract expiration date must be greater than the contract effective date. So if those dates are swapped, the expiration date is less than the contract effective date, a fatal error will be set, because that's just, in many cases, they're just transposing those dates. In the case where a contract expiration date is less than the first day of the reporting month, and the reporting month is what's identified in the ISA 02 segment, if it's prior to the reporting month, meaning that the contract has expired, in that case, we will set a warning message, and this is because this will allow time if you're going through contract renewals or renegotiations and you just don't have that contract signed yet, you'll get a warning message. But we do expect those dates to be all within the reporting, active within the reporting month as you start getting into the annual network certification date activity. All right, next slide. All right, so those are the two main areas that were made, changes that were made in version 3.01, just some minor changes. For the submission process, this is just a reminder that for the MHP, the DMC ODS, and the counties that are now participating an integrated behavioral health plan model. The counties will continue using the same SFTP folders that you are currently using. For the IBHPs, we just put an example here of a county that is transitioning to an IBHP. You would continue to use the same folder that you submitted your MHP and DMC ODS file. Next slide. For the testing process, the time frame from April, because the counties were aware of these changes back in January, we had identified the time frame from February through April. This is your time to make the changes, test your own system, do what you need to do to make these changes. For a testing environment on the DHCS side, we will be deploying the testing environment on May 1st. So you'll have the full month of May to submit as many transactions as you need for you to feel confident that your file looks good. So we will not be validating your test files. It'll be your own self-certification. So when you're ready to go into production, no later than June, because June 1st is when the new implementation guide becomes effective. So when you're ready to go into production, we'll run similar quality checks that you've done in the past. And if there's any issues with those, then you'll have an opportunity to correct those files. But the important note is that you must be ready to submit your 274 files starting in June. So no later than June 10th, we would expect to see a 274 file for the May reporting period, and then each month after that. And any resubmissions of files for previous months would need to be in the new format. And until the new companion guide becomes effective in June, you must continue submitting your 274 files for the month of March and April using the current version of the companion guide, which is version 2.1. All right, next slide. All right, so this is just another view of the deployment timeline. So back in January, like we said, we had released the companion guide 3.0, and then February through April, this is when counties and DHCS will be modifying your system. And the last bullet on this is counties must continue to submit their 274 files using version 2.1. May is when the test environment for DHCS becomes is deployed. So counties may submit as many test submissions as you need. But again, during the month of May, you must also submit your regular 274 file using version 2.1. And then starting in June is when you'll begin submitting your 274 files using version 3.01, and then each month after that. And DHCS, just as a reminder, DHCS does plan to continue using the July file for the annual network certification. So when you get to that point of submitting your July file, we'll be looking at those files even closer for use in the annual network certification process. Next slide. So all the documentation for the updated companion guide has been loaded to the 274 SharePoint site, and this slide includes the link for that. And we include both the version 2.1 and version 3.0 because 2.1 is still active until the end of May, and then starting June 1, version 3.01 becomes active. And 2.1 will be discontinued May 31st, so you'll no longer be able to use that starting in June. Next slide. We've also included the same documents in the documentation center. So this will become the new place where all 274 provider companion guide and relevant information will be loaded. So eventually we're going to be getting discontinuing the SharePoint site. So we're including all relevant documents in this folder as well. So in this folder we have both the companion guides, or in this team site, both the companion guides 2.1 and 3.01. We also, Christine will be talking about the verification file update, but that folder is also in this location as well. Next slide. We also have some minor updates to the sample formatting tool that was published back in February. And that document is available on the 274 SharePoint site. We've also added it to the documentation center just recently, so it's not on the previous slide. But you can access the formatting tool where the arrow is pointing under the sample files. And that'll give you the basic instructions on how to format your file. Next slide. All right, so that's it for the companion guide update. So I think we can, I see a few questions before we move on to Christine's section.
Yes, sir. Just to let you know, we do have a question from Christina Villegas from LA County. I guess she wants to know, for LA County DMC, are we using the 274 provider county production files or the BHIN PACES folder to submit the new files?
So you'll continue using the same PACES, the SFTP folders that you submit your current 274 files. We're not changing that. So you won't be submitting them to the BHIN folder. It'll be in the PACES folder. And if Jeff, I think you're here. I don't know too much about the BHIN.
I was just going to respond in the chat and kind of sort that out.
Right.
BHIN and PACES together doesn't quite make sense. So I'm going to put information about the SFTP directory into the chat.
And Christine, your county's already submitting your DMC ODS files, so you'll continue with the new companion guide updates. You'll continue to submit the 274 DMC ODS to the same location.
Yeah, if you're already submitting there, if your organization is already uploading files, the 274 file, to an SFTP directory, continue to upload to that directory. That is the PACES SFTP directory. So, and I'll put the path in the chat.
Well, thank you, sir, and Jeff. So it looks like that's all the questions that we have so far. Thank you, Sarah, for that wonderful presentation. So let's go ahead and over to the next slide. So our next topic will be changes to the 274 Behavioral Health Validation Response File, also known as VRF. So I'd like to hand it off to our next presenter, Christine Fessler, Chief of the Data Quality Reporting Unit.
All right, can you all hear me okay? I know sometimes WebEx has a double mute aspect, so it's really kind of frustrating. Very much looking forward to when we do migrate to Microsoft Teams, at least that way, so we can have a consistent issue, right, with one platform. If there are any go for it issues. All right, so welcome. Thank you very much for your time today to walk through the exciting changes to the validation response file. I know that this webinar is a broader audience, so I will just mention that while this presentation is targeted towards the behavioral health plans and programs and counties, that this validation response file applies to all 274 files, which includes the dental and medical. So just to kind of highlight, there was a communication that was sent out to the behavioral health plans, the 274 medical and the dental managed care plans on February 20th. notifying you all of the changes to the validation response file. We are hoping that these changes are beneficial to all of you, as well as for DHCS and our data quality usage. And just a couple of things to highlight: that this change will go into effect, and effect is DHCS PACE's production beginning April 1st. So something to please pass along to your technical teams if needed is that if any of the systems use XML readers or software that processes the information in the VRF, please ensure that the systems are modified prior to April 1st of 2025. Okay, so one of the things that is important about the validation response file change is this will replace the need for counties on the behavioral health side to have to submit the PDSRF and the SRF to the SharePoint site on a monthly basis. So essentially the changes that are made in the validation response file mean that it is essentially replacing the need for counties to submit the provider data submission reconciliation form, also known as the PDSRF. So, all right, so thank you. This slide right here, I just wanted to kind of show again, where do you, oh, sorry, if we could go back one, apologies. Again, this is where you would find the validation response file to download. For counties, there's a county folder on the PACE's SFTP site. Please, please, please download your response files. This is very key to understand whether or not the file was accepted or rejected. It's very important that you all have access to this and are able to ingest and understand the validation response files. It's going to be a lot faster for you all to be able to see that when it gets posted in the system than to send us an email, you know, to have us check it out. So please make sure that you all have access to your response folders and are able to download and view them. All right, so next slide, please. All right, so the current 274 behavioral health VRF, I've highlighted some of the things that are going to be changing just to make sure that you all know you're using the appropriate version. So for here, this is the current. It's response version 1.3. You'll see the file name that's highlighted there. And then, of course, the validation status you want to look at. In this example, it's accepted. Obviously, if you see rejected there, it means you need to look at the response severity and figure out, and looking at the companion guide, as well as the validation response file guides, why the file was rejected, fix those errors, and resubmit as soon as possible. Okay, so if we could go to the next slide, please. All right, so again, beginning April 1st, that is when the VRF, this new version, will go into effect. It also means that counties are no longer required to submit PDSRF and the VRF to the 274 county SharePoint site. We're really hoping, and thanks to Data Exchange and Sarah for spearheading this effort to reduce the workload for counties and you know, other data submitters here, is we're really hoping by including some of those header counts in the validation response file that counties, dental managed care plans, and medical managed care plans will be able to identify any critical errors in their counts, their reporting month, and just be able to catch things faster and be able to resubmit files appropriately. So again, here, April 1st, that's a date to remember. It is coming up. It is not April Fool's. This is, you know, a good thing that's happening. So if we could go to the next slide, please. All right, so here is a snapshot of what the new VRF version 1.4 will include. You see here we've highlighted the network data year and month. And so this is something that will, on our side too, is that this will allow the plans to be able to confirm right away whether or not that the submitted 274 reporting period listed here is the intended reporting period. So this will be very helpful for WELL, as well on the data quality reporting side for us to just double check that the file for the reporting period was accepted in a timely manner. And then for here, there are also highlighted the distinct group tax ID counts, the distinct site NPI counts, and the distinct provider NPI counts. Now, again, I'll just say, I know that there are probably some managed care plans that are on this webinar. So please refer to the communication that was sent out February 20th from Data Quality Reporting Unit. There are a few differences for the 274 validation response file version 1.4 that are specific to the medical managed care provider files. So again, this is just specific to behavioral health, but please refer to the communication, the email that was sent out February 20th for those other provider types. All right, so if we could please go to the next slide. All right, so the communication was a while ago, like I said, February 20th, that was notifying the counties and the plans that if you so chose to do so, you could have used the PACES test environment to see the new validation response file that was kicked off March 1st. Obviously, that is ending in a few days, and PACES production environment will be launched April 1st. So again, there's some great resources on the DHCS Teams Documentation Center. The links are in here. There are sample files already for you to view. And yeah, please let us know if you follow those links and you don't have access. Please email Data Exchange or Data Quality Reporting Unit, and we will get you access to those sites. So next slide, please. All right, so the next few slides are details. And again, this is kind of a going over again of the email that was sent out on February 20th. So again, please share this with your technical teams to ensure that the systems, if you are using the XML readers, to please make sure that those are updated by April 1st. So again, network data year and month. This is the reporting period specific to the segment in the 274 files listed here. Again, this is very important for plans and counties to be able to verify that the reporting period identified is the intended reporting period for the file. And again, if it is not, then plans must immediately correct this and resubmit the 274 file. And again, the companion guide, if there are questions around resubmitting 274 files, those are the information about how to do that is in the companion guides. So please refer to the companion guides. Any questions that you might have about that will be much more quickly addressed by reviewing the companion guide than sending an email to one of our mailboxes here at DHCS. So let's go ahead and go to the next one. Thank you. So the distinct group tax ID count. Again, this is the total distinct group detail records based on the group tax ID. Again, this is a way for the plans and counties to observe if the count is as expected or intended. If it is not, you must immediately correct and resubmit the 274 file. So the next slide, please. distinct site NPI count. Again, this is the total distinct site detail records based on the site NPI. Again, if upon reviewing the validation response file, if you view the count is not as the intended count, please make that correction and resubmit the file to DHCS PACES. And then the last slide here relates to the distinct provider NPI count. Again, these are the distinct provider detailed records. Again, if the validation response file is showing or producing a count that differs from what a county expects, to please make that correction and resubmit to DHCS PACES SFTP. So I know that Jen made some clarification in the chat regarding the exact, what I mean exactly when I say DHCS PACES SFTP site. So any questions that you have around that, please put in chat. And I think that this kind of concludes the validation response file. And please let me know if there are any questions.
Thank you, Christine, for that presentation. So just going off what Christine just mentioned, Jeff Jennings did put in the chat the PACES directory for the counties. So Christina, if you have any other questions, go ahead and let us know. And there's another question from Christina. Will the monthly quality checks change with the new CG? I'm assuming that's companion guide, correct?
Yeah. Oh, sorry.
So there are going to be changes.
I was going to answer that question, Alvin, sorry.
Thank you, Sarah.
Yeah, because that's related to the companion guide. So yes, Christine, there will be some updates to the quality check, specifically around the new data elements that were added. So for example, we added a new data element called Indian Healthcare Provider Contract Status. And so with that new data element, there may be a new quality check to make sure for the counties that have ICPs in their counties that they're identifying whether they already have a contract in place, or they have a contract in process, or they were not able to contract with an ICP. So that'll be one area for sure where there will be a new quality check. We also added some new data elements that impact the DMC ODSs, where utilization, the maximum member counts and the actual member count, those were separated at the site level based on adult and children. So there'll probably be a new quality check to make sure that for the DMC ODSs that we're reporting utilization using those new data elements. And then for the IBHP, the plans that are participating in the integrated behavioral health plans, we will be developing quality checks that are specific to the new contract type. But those quality checks will look very similar, since that's an integrated file. They'll look very similar to the quality checks that you currently have for the mental health plan side and the DMC ODS side. So yes, you will expect some quality check updates based on the new companion guide.
Thank you, Sarah. There's a question from Janie. If the distinct count is different, but the response status accepted, is the submission required? Looks like Christine Fessler responded, yes, if the file is accepted, but the counts are not as expected or intended, you must correct and resubmit the file per directions mentioned in the companion guide. And looks like that's all the questions we have so far. So thank you, Christine and Sarah, for the presentation. So over to the next slide. We're going to be talking about our resources. So behavioral health managed care, if you guys have any specific questions on specific topics for behavioral health managed care, those are the resource emails listed below. Next slide. For dental managed care, those topics related to dental managed care, those are the resource emails listed below. For programs for all-inclusive care for the elderly, also known as PACE organizations, anything related to specific topics for PACE, those are your resource emails. For medical managed care program, for any related specific topics, those are the resource emails listed below. For medical managed care data quality, looks like pertaining to PACE's SFTP, please look at the resource email below for that one. For encounter data quality, anything related to 837 encounter data, please submit it to the email listed below. For any technical support relating to specific topics such as JSON, DHCS Documentation Center, and Excel templates to DCU will be data exchange. Anything related to ECM, CS, CCM, or JSON files, those are the emails listed below. Just to let everyone know, our next webinar preview for April 2025, April Fools, we will focus on the annual address. The meeting for that is April 30th. Wow, it's my birthday actually. From 10 a.m. to 11 a.m. Yeah, that is not an April Fool's joke, by the way. Oh, we just have a quick question from Justin Miller. Can someone put in the link to get to the new VRF 1.4? If somebody can provide that link, that would be greatly appreciated. Oh, thank you, Christine. It's not until the 30th next month anyway, but thank you guys. Yeah, so next slide. So once again, thank you guys for all your insights and all your information. Like I said, if you have any questions or concerns about the webinar or our webinar series or this event, please submit it to the MCDSS mailbox at dhcs.ca.gov. And if there are any other questions, yes, go ahead, Jeff.
Actually, Alvin, if you could hang on just a minute, it's Jeff Jennings.
Yes.
Okay, yeah, I see the documentation Sarah shared. Is that to the 274 SharePoint site, Sarah, or is that to the documentation center? It looks like it's the doc center.
It's, yeah, so Jeff, it's the documentation center, since we are trying to transition everything to that site.
Yeah,
so
yeah.
in this link, it includes the updated companion guide that we talked about. It includes a folder for the VRF that Christine talked about. And I had also mentioned the updated sample formatting tool. There's a folder for that as well in this link.
Okay. I do want to point out that we have discovered that sometimes links that are to a specific document or a specific folder in the Doc Center won't resolve correctly. And I see Deborah Gonzalez, hang on, I'll add something about what you're saying. So the link that Sarah just shared might work. We can also share, excuse me, a link that is the root link to the entire documentation center. That link tends to work all the time. Once you get to the Doc Center, you can navigate to the PACES channel and find all the documentation and samples that Sarah is referring to in that channel. So I will share a link and more information. The Doc Center is a Teams site, Justin, so that's what it is. Although Teams is combined with SharePoint. So that's why there's a SharePoint thing involved. It's the usual thing from Microsoft. It's not exactly what it appears to be. But we'll work with you to make sure you've got the access you need and you can find the materials you need. And for Deborah Gonzalez, who put in the chat that it's not available, well, let's make sure, Deborah, that you actually have been granted access to the documentation center because it does have to be granted. So if you are not listed as currently having access, then we'll get that fixed for you, send you a link, and you should be able to access it then. If you have any issues accessing the DHCS Documentation Center, please send an email to dataexchange@dhcs.ca.gov, and we will get that worked out for you right away. And then here's a route link. In other words, this is to the entire doc center. Once you get there, and hopefully that link works, once you get there, you should be able to navigate around. So Teams is a pretty good place to store docs. It's not perfect though. And that's why we have to give you some support. Sarah, you've got your hand raised.
Okay. Yeah, so if this is for Deborah Gonzalez, so just a reminder that this whole discussion and the links that we're providing are for the counties for the behavioral health 274 submissions, not for the commercial plans on the medical managed care side. So just be aware of that. I know sometimes that it gets a little confusing there.
Yeah, it is. It's getting a little confusing as we work through our integration processes. But again, we'll give you as much support as we can to make sure that you're getting what you need. So as Sarah said, these changes right now are specific to the counties. We will communicate about any managed care changes that are coming up. And then again, Joan, I will grant access to you right now, but I'm putting something in the chat about where to request access.
Hey, Jeff, is it one of those where if you go click on that link, it pops up like that blank screen in the box that says you need to request access?
It's weird.
Is it one of those things?
That can happen. There's different things that happen. So, excuse me. Every time one of these issues comes up, we are researching it and studying it, trying to figure out what the root cause is and how to resolve it. So, but we acknowledge that there are some issues with links. German or Herman, again, you may not have access. So I'm assuming this is Herman with Marin County, I believe. And if that's the case, we can add access for you. Okay. Herman, your last name, because it's not showing, I just want to make sure I have it right.
Valencia looks like. Sure.
Okay, thank you.
Valencia.
Thank you, Herman. Joan, we can probably try to do a bulk ad, but to be honest, I'm not sure how well that's going to work. So we'll do our best, but if folks are trying to access the doc center and not being able to and need access, please send a request to that email address I just shared, and we will get you access right away. We'll look and see if we can move people over from the SharePoint site. But again, sometimes those things don't work out all that well. So just want to throw out that caveat.
And also too, you would think that once we migrate to MS Teams, it should work too, right?
So I'm making a note. I'm going to immediately add Justin, Joan, Herman, and we'll look into what Tony Van Nocker is reporting in terms of files, and Deborah Gonzalez. So that's what I've got right now. But as I said, if you send a message to the data exchange at dhcs.ca.gov mailbox, we'll get your access going for you right away. Thank you guys so much. And yes, Alpine County, yep. We'll make sure we get all that added for you.
Yeah, we're looking in the chat as well. So if there's anybody else that adds their name or whatnot, we'll make sure that we get it to you, Jeff, as well.
Yeah, and for requests, please give me your full name because I'll need it. I have to add it based on email address. So that's why I need specifics. So yeah, if there's anyone from Alpine County that specifically needs access, go ahead and send an email to that data exchange address, and we'll add everybody that you list. So, okay, that's my spiel. Thanks, folks. Really appreciate it.
Thank you, Jeff. Appreciate it. So once again, thank you guys. Like I said, if you have any questions or concerns or comments, you just want to wish me a happy birthday, they're not, just put in the chat also. So thank you guys, and I guess we'll see you guys next month. We out.
Got it, Cindy. Thank you, everyone. Thank you.
Thank you.
Thank you, Albert.